Are you struggling to manage the symptoms of attention deficit hyperactivity disorder, ADHD? Don't worry, you're not alone. With numerous treatment options available, it can be overwhelming to navigate through the sea of choices. Two commonly prescribed medications for ADHD symptom relief are Dexmethylphenidate and Methylphenidate. But which one is right for you? In this video, we will delve into the details of Dexmethylphenidate versus Methylphenidate, comparing their effectiveness, side effects, and dosing options. We'll provide you with everything you need to make an informed decision about your ADHD treatment. Dexmethylphenidate and Methylphenidate work by increasing the availability of certain chemicals within the brain that play a role in attention and impulse control. They can help improve focus, reduce hyperactivity, and manage other ADHD symptoms. However, these medications differ in how they are metabolized and their duration of action, which may influence their effectiveness and tolerance. Whether you're considering starting medication or looking to switch from one to the other, this video will serve as your comprehensive guide to determine the best option for your specific needs. Say goodbye to confusion and embrace clarity on your journey to finding the right ADHD symptom relief. Understanding ADHD and its symptoms. Attention deficit hyperactivity disorder, ADHD, is a neurodevelopmental disorder that affects both children and adults. It is characterized by symptoms such as inattention, hyperactivity, and impulsivity. People with ADHD often struggle with maintaining focus, following instructions, and completing tasks. The symptoms of ADHD can significantly impact daily life, including academic performance, work productivity, and social interactions. Therefore, it is crucial to find effective treatment strategies to manage these symptoms and improve overall functioning. Overview of Dexmethylphenidate and Methylphenidate. Both Dexmethylphenidate and Methylphenidate belong to a class of medications called stimulants. They are commonly prescribed for ADHD symptom relief in both children and adults. These medications work by increasing the levels of certain chemicals, such as dopamine and norepinephrine, in the brain. This helps to improve attention, reduce hyperactivity, and control impulsive behavior. Dexmethylphenidate is a modified form of methylphenidate and is sometimes referred to as the right-handed isomer. It is believed to have a more potent effect on dopamine reuptake, which may result in increased efficacy and a lower risk of side effects. Dexmethylphenidate is available in both immediate release and extended release formulations. Methylphenidate, on the other hand, is available in various formulations, including immediate release, extended release, and transdermal patches. The immediate release form typically lasts for a shorter duration, requiring multiple doses throughout the day, while the extended release forms provide longer-lasting effects, requiring fewer daily doses. Key differences between Dexmethylphenidate and Methylphenidate. While Dexmethylphenidate and Methylphenidate share similarities in their mechanism of action and overall effectiveness, there are some key differences to consider when choosing between the two medications. One notable difference is the ratio of isomers present in each medication. Dexmethylphenidate contains only the right-handed isomer, which is believed to be more effective in treating ADHD symptoms. Methylphenidate, on the other hand, contains both the right-handed and left-handed isomers, which may contribute to a slightly different pharmacological profile. Another difference lies in the duration of action. Dexmethylphenidate, especially the extended release formulation, tends to provide a longer-lasting effect compared to most methylphenidate formulations. This can be advantageous for individuals who prefer fewer daily doses or require symptom relief throughout the day. Additionally, Dexmethylphenidate may have a lower risk of certain side effects, such as insomnia and appetite suppression, when compared to methylphenidate. However, individual responses to medications may vary, and it is essential to discuss any concerns or potential side effects with a healthcare professional. Effectiveness of Dexmethylphenidate and Methylphenidate in treating ADHD symptoms. Both Dexmethylphenidate and Methylphenidate have been shown to be effective in reducing ADHD symptoms and improving overall functioning. Numerous studies have demonstrated their ability to enhance attention, reduce hyperactivity, and control impulsivity. A randomized controlled trial comparing the effectiveness of Dexmethylphenidate and Methylphenidate found that both medications significantly improved ADHD symptoms in children. However, dexmethylphenidate was associated with a greater reduction in symptom severity compared to methylphenidate. Similarly, a meta-analysis of studies comparing the efficacy of dexmethylphenidate and methylphenidate in adults with ADHD found that both medications were effective in reducing symptoms. However, dexmethylphenidate demonstrated a slightly higher effect size, suggesting a potentially greater overall impact on symptom relief. It is important to note that individual responses to medication can vary, and what works for one person may not work for another. Therefore, finding the right medication and dosage may require some trial and error under the guidance of a healthcare professional. Common side effects of dexmethylphenidate and methylphenidate. As with any medication, dexmethylphenidate and methylphenidate can cause side effects. The most common side effects include insomnia. Stimulant medications can interfere with sleep patterns, leading to difficulty falling asleep or staying asleep. Decreased appetite. Both dexmethylphenidate and methylphenidate can suppress appetite, leading to weight loss or poor appetite. Headache. Some individuals may experience headaches as a side effect of these medications. Stomach upset. Nausea, vomiting, and stomach discomfort can occur, especially when starting or adjusting the dosage. It is important to discuss any side effects or concerns with a healthcare professional. They can help assess the benefits and risks of medication and make any necessary adjustments to optimize treatment. Factors to consider when choosing between dexmethylphenidate and methylphenidate. When deciding between dexmethylphenidate and methylphenidate, several factors should be taken into consideration. These include individual response. Different people may respond differently to each medication. It may be necessary to try both dexmethylphenidate and methylphenidate to determine which one provides the most effective symptom relief with the fewest side effects. Duration of action. Consider whether you prefer a medication that requires multiple doses throughout the day or one that provides longer-lasting effects. Side effect profile. Pay attention to the potential side effects associated with each medication and discuss any concerns with a healthcare professional. Dosage flexibility. Dexmethylphenidate and methylphenidate are available in different formulations and dosages. Consider which option provides the most flexibility in dose adjustments to optimize symptom relief. Cost and insurance coverage. It is important to consider the cost of medication and whether it is covered by your insurance plan. By considering these factors and discussing them with a healthcare professional, you can make an informed decision about the most suitable medication for your specific needs. Dosage and administration guidelines for dexmethylphenidate and methylphenidate. The dosage and administration guidelines for dexmethylphenidate and methylphenidate may vary depending on the individual's age, weight, and specific needs. It is crucial to follow the instructions provided by a healthcare professional and carefully monitor the response to medication. Dexmethylphenidate is available in both immediate release and extended release formulations. The immediate release form is typically taken 2 to 3 times a day, while the extended release form is usually taken once daily. Dosages may be adjusted based on the individual's response and tolerability. Methylphenidate is available in various formulations, including immediate release, extended release, and transdermal patches. The immediate release form may be taken 2 to 3 times a day, while the extended release forms typically require once daily dosing. The transdermal patches are applied once daily and provide continuous release of medication over a specified period. It is important to follow the prescribed dosage and administration instructions and communicate any concerns or issues with a healthcare professional. Precautions and potential risks of dexmethylphenidate and methylphenidate. While dexmethylphenidate and methylphenidate can be effective in managing ADHD symptoms, they are not without risks. It is essential to be aware of potential precautions and risks associated with these medications. Stimulant medications, including dexmethylphenidate and methylphenidate, can increase heart rate and blood pressure. Therefore, individuals with pre-existing cardiovascular conditions should use these medications with caution and under the supervision of a healthcare professional. Other precautions include avoiding the use of these medications in individuals with a history of substance abuse, as they may have a higher risk of misuse or dependence. Additionally, individuals with certain psychiatric conditions, such as psychosis or bipolar disorder, may require careful monitoring when using stimulant medications. It is important to discuss any pre-existing medical conditions, medications, or concerns with a healthcare professional before starting dexmethylphenidate or methylphenidate. Alternative treatment options for ADHD symptoms. While dexmethylphenidate and methylphenidate are commonly prescribed medications for ADHD symptom relief, they are not the only treatment options available. Some individuals may prefer to explore alternative or complementary approaches to managing their symptoms. Non-medication strategies such as behavioral therapy, counseling, and lifestyle modifications can be effective in managing ADHD symptoms. These approaches focus on developing coping mechanisms, improving organizational skills, and addressing underlying psychological factors contributing to ADHD symptoms. Furthermore, certain dietary modifications such as reducing sugar and processed foods and incorporating regular exercise and sleep routines may also help improve attention and overall well-being. It is important to discuss alternative treatment options with a healthcare professional to determine the most appropriate approach for your specific needs. Conclusion: making an informed decision for ADHD symptom relief. When it comes to managing ADHD symptoms, dexmethylphenidate and methylphenidate are two commonly prescribed medications to consider. While they share similarities in their mechanism of action and overall effectiveness, they have some key differences to consider. By understanding the differences between dexmethylphenidate and methylphenidate, as well as considering factors such as individual response, duration of action, side effect profile, dosage flexibility, and cost, you can make an informed decision about the most suitable medication for your specific needs. Remember, ADHD management is multifaceted, and medication is just one component of a comprehensive treatment plan. It is important to work closely with a healthcare professional to determine the most appropriate approach to managing your symptoms and improving overall functioning. With the right guidance and support, you can navigate the options for ADHD symptom relief and find the best path towards a more focused and fulfilling life. Thanks for watching.